My name is Beresin. I'm a general and child and adolescent psychiatrist at Massachusetts General Hospital. In 1981, my chief Tom Hackett asked me to be associate director of what he called the Committee on Postgraduate Education. So I was the DOPE, Director of Postgraduate Education. And I stayed in that role for 10 years and created 60 courses. The difference between the CME then and now is that all of our courses were live. The mission and vision originally was to use the most evidence-based, research-founded material that could be applied to clinical practice. The key was really the application. Folks came to us wanting to know that their work was reliable, valid, accurate, and up-to-date. What I realized is that patients with the most knowledge and understanding of their conditions do the best clinically. And actually, doctor comes from the Italian doctore, which means teacher. My mission as an educator was for doctors to be educators of their patients and families. And the more they knew, the better they did. Dr. Katz really combines all of those worlds of education and community involvement. And that is bringing together health professionals, parents, caregivers, folks that use the system of healthcare. Anybody, we're all patients after all. And we all want to know about our own conditions. It's not because it's unteachable or unknowable, it's that there's not airtime given to mental health conditions. And we at Dr. Katz want to change this. What we want to do is we want to break down the barriers of stigma, of taboo, and bring it down home and down to earth. Because let's face it, mental health conditions are more common than strep throat. During the course of a lifetime, 1 in 2 individuals will have a psychiatric disorder. 1 in 4 begin before 14, and 75% begin before age 26. Depression is the #1 burden of illness in the world. That means more loss of income, more disability, more problems, and sadly, dysfunction, and sometimes suicide. But yet how often do you hear about depression in the news? Or the aspects of depression that Dr. Katz provides? Diagnosis, symptoms, treatments, and the side effects, and also diet, exercise, good sleep, nutrition, yoga, meditation, all the other things that can provide help for folks with depression. So what we're trying to do is cover the broad waterfront of mental health and behavioral problems for all of us, health professionals and all of you out there in the world.